Oh, Dr. Craske, because of COVID-19, we keep reading about an increase of anxiety and depression around this country. Can you just speak to how significant those numbers are right now because of COVID-19?
Yes, certainly. It is indeed the case that when we're faced with uncertainty of the nature that we're currently dealing with, everybody's level of stress and anxiety is going to be higher than ever before. It's interesting because even prior to COVID-19, there was a trend going on for rates of anxiety in particular, as well as depression, to be increasing, particularly among 18 to 25-year-olds, for reasons that are not entirely clear. But that rise was happening with the COVID-19 and this threat to health and threat to emotional and financial security in the long haul. Rates are probably increasing even higher. Most of the data right now are anecdotal, but certainly all of us can probably attest to people that we know, if not ourselves, who are experiencing those elevated rates. I think it's the combination of health concerns, economic concerns, and just the feeling of uncertainty, of not knowing when is this going to end and how does it end.
Yeah, just not a whole lot of control because of what's happening with this pandemic. Dr. Craske, I want to circle back to something you just made reference to. You said that the numbers before COVID-19 were increasing. Is it the numbers legitimately were increasing in terms of sheer volume, or the reporting and people feeling more comfortable about talking about their symptoms is really the reason for that push?
Yes, it's a good point. And I think it's probably a bit of both. Certainly, there's been an increased awareness of mental health. We have a long way to go. There's still quite a lot of stigma, but in the younger generation, there's more acceptance and more willingness to talk about mental health. And that means that when people fill out surveys or when interviews are done, they're more willing to talk about it. If you look, for example, over the college age group for the last decade, rates of reported anxiety in the realm of being diagnosed or treated, so not daily anxiety, but pretty severe anxiety, those rates have doubled over the last decade in college age samples. And rates of depression have increased by 60%. So part of that is no doubt related to being more willing to talk about it and seek help, which is a good thing in many ways. But there seems to be something else going on too. It's hard to know. Is it something about expectations of what one should be able to achieve in life and feeling like you're not meeting expectations? Is it social media, which somehow contributes to the awareness of what others have and the perception that one does not have what everybody else has? It's hard to know, but they certainly were on the rise beforehand.
You know, we talk about the increase in the number of people that are dealing with anxiety and depression, and now they're increasing even more because of COVID-19 on individual campuses like UCLA. And I know there's conversations about whether or not we're going to have students or if there's going to be a hybrid model when the fall semester starts. But what are some of the things that you as sort of a healthcare professional and understanding this business are going to institute to make sure that the mental health aspect for a lot of the students on this campus are going to be able to be taken care of?
Right. Yeah. Yes. So we, again, even before COVID-19, because of the rising demand for services for depression, anxiety, we had already started developing a program. We call it the STAND program, Screening and Treatment for Anxiety and Depression. That's a largely technology-driven and thereby scalable program that could be available to all students. So this is a system where we have a mental health tracker. Imagine it like you go in every now and then to check on a physical well-being. You check on your blood pressure or your weight or something else. Yeah. We're trying to build this notion of alongside your physical tracking, you should be doing mental health tracking. It's a very brief survey that you do online, and that then gives immediate feedback, which then says, you know what, you're having a little bit of anxiety or depression, why don't you? And then we triage people into a level of care, which could be online skill development in how to manage and regulate emotions with the help of coaches. Or it could be, you know what, your levels of depression, anxiety are up there. Why don't we reach out to you and see if we can offer you help? So that program, which had already been in place, is now being expanded to manage the COVID-19 distress that seems to be complicating the original anxiety and depression that everybody was feeling.
I would imagine too, public figures being willing to talk about their own struggles. Beyonce, I know you guys at UCLA are in partnership with her. How important is it to have people like Beyonce, one of the biggest stars on the planet, Kevin Love, as notable an NBA player as there is, being willing to go out and say, you know what, like not everyone is feeling great and healthy.
Yeah. I really applaud them for doing this because it's making themselves a bit vulnerable as well to declare. Kevin is quite clear about his own struggles that he's had, and what he's doing at the same time is it's multi-pronged, because what he's saying to the world is, I've had these struggles, but I'm continuing and I'm playing and I'm doing wonderfully. And that ability to recognize it, to say I have had moments of depression or anxiety doesn't mean I can't function. In fact, I can excel. I can still be an incredible player. And that messaging to the world is really, really important.